Hello everyone, my name is Kristen. I'm going to be talking about role-playing today. And first off, I'm just going to define role-playing for you. So in our textbook by Bastable, she did define this as an instructional method by which learners actively participate in an unrehearsed dramatization. And it's pretty key that it is unrehearsed. There is no rehearsal for it. There's no script. It's just role playing back and forth. They're given a scenario, and then the learners go from there. Bastable goes on to say that the participants that are assigned characters act as they think the character would act in reality. So, yeah, they're given characters, and then they act as they feel the learners act as they feel those characters would act. And role-playing allows the participant to understand why some people act the way they do, because it puts the participant in their shoes. So they actually get to act as they feel the person would act, and that helps them understand why people act the way they do. Role-playing, according to McNamara, an article that I found, a journal article that I found, role-playing uses both the motor and cognitive skills, which allows the entire brain to be involved in learning. And this really helps, role-playing really helps learners learn because it's using the cognitive and motor. So it's not just one or the other, it's both and, which really helps the learner solidify the learning for the learner. Role-playing helps the learner see and act in the shoes of another person, and sometimes even another culture. So it can really, you can really use situations and scenarios, different things that nurses or anyone would encounter on a workly day-to-day basis, allowing people to experiment with this before they're actually doing this in real life. So it can help prepare someone. Role-playing helps in the process of making decisions and judgments, clarifies behaviors, and encourages looking beyond the self and into another person in a close and more intimate manner than reading or lecture allows. And that was from another article that I found, just a quote there that I felt like really captured it well, that it's more than just reading or lecture. You're actually acting and making decisions and clarifying and doing all that through the role play. So how do you actually role play? The role-playing how-tos. The textbook just really laid this out very nicely, so I kind of took that just from there. But Bastable, the educator, she says the educator must design a situation that gives the learner enough information to assume the role of an individual without actually giving them a script. So you're not giving them too much information because you want their imagination to run with it, but you are giving them enough that they can actually role play, but there's no actual script given. Throughout the exercise, the learners will do and act as they feel their character would, pretending to be this person that they're given to the best of their ability. During the role play, there are also observers, and they will participate in group discussion at the end. So everyone has a part there. You can do it in a bigger group than just the role play. There's some people that can observe and can touch base with how both characters are feeling. It allows them to get a bigger picture. And the learners must be comfortable with each other in order for this exercise to be fully beneficial. So if the learners aren't comfortable with each other, then they won't act as they normally would, or they won't act as well. And so they need to be comfortable with each other, have spent enough time with each other, they've gained rapport with each other that they can be able to act in freedom. And then the actual length of the exercise, the role-playing, can be anywhere from 5 to 20 minutes long. It's best done in small groups, and it should be followed by a time of discussion or debriefing period. So there's a briefing period where you explain the situation, there's the actual role-play period, and then there's a debriefing period where you discuss it. And that's where a lot of the learning takes place, is in the discussion, because you can talk about what went good, what went poorly, what needs worked on, and just everything that was going on there. Let's see. The role-playing is an affective domain. That's the learning style there. So role-playing uses the affective domain of learning. It's focused on attitudes, interests, feelings. This is an act, like you're acting, so you're feeling things, and that's affective domain is feeling. So it's very much an affective domain. you're walking in someone else's shoes with no risk, so you can put yourself out there and try and understand how life would be in the life of another individual. And you gain empathy for a person's role because of acting in their shoes. You can gain empathy for how people experience life on a day-to-day basis. And you can observe the role play and also actively participate in it. So there's two different roles here, and both are very beneficial. And you can take turns, flip out, so you can get a experience in all of the roles. I have some different examples of affective domain. So, for example, if a nurse goes to an educational event and there's a stand there where they have glasses that allows the nurse to put these glasses on and see what it's like to live in the life of a visually impaired patient, this would be putting the nurse in the shoes of the patient just to see what it's like to not even be able to see, to walk around to go to the bathroom or to see the blue sky outside. It puts them in their shoes and helps them realize what it's like. That one was in the Bastable textbook. Another one is a nurse and a patient can role play as the nurse displays culturally inappropriate behavior to the patient who is from a different culture. So that can be a learning experience of how to be culturally appropriate versus culturally inappropriate. Another example would be a nurse and a patient role play as the nurse relates to a patient who is mentally unstable and feels that her husband is trying to poison her with chemicals. And that's actually something that I experienced. I had to speak with a patient on the phone who really felt like her husband was trying to poison her. And so it would have been helpful for me to role play that, so I would have known how to respond to that before I was actually in that situation. There are definitely pros and cons to role-playing. Some advantages would be that role-playing does allow the learner to experience and explore feelings and attitudes in a safe environment, because it's not real life, it's just role-play. Another pro would be that this can bridge the gap between understanding and feeling, because you're not just learning, you're actually feeling. So it's taking it a step further. Role-playing can narrow the role distance between and among the clients and professionals. Role-playing also reduces anxiety and increases confidence. Because you're doing it in a safe environment, it reduces your anxiety and increases your confidence as you go through the role play and actually work it out. It allows you, if you do it right, it increases your confidence and it reduces your anxiety because you know you can do it. Just another quote here from an article that I found. When you role play, you gain a better professional know-how when the learner understands the situations, roles, and questions asked or to be asked, the answers they should give, and how to actively listen. So that's just something that role-playing helps to do. And the advantages definitely outweigh the disadvantages, but you can only do this in small groups. That would be a shortcoming. Another thing is that someone could over-exaggerate their role, which would kind of decrease the learning because the role would be over-exaggerated, so it wouldn't be as real, or you couldn't learn from it as much. And so if the role is over-exaggerated, it does lose its credibility. Another thing that could be a shortcoming is if the learners are uncomfortable with each other, then they're not willing to give them themselves, and the experience wouldn't be the same as it would if someone would be willing to give them themselves. So I have examples here of patient, peer, and student teaching. So just some patient examples of peer-to-peer. I don't feel like it's used as much in the patient to nurse relationship, but the patient, for example, the patient and the nurse could role play about how to use certain medical equipment, like an inhaler, a colostomy, injecting insulin. So for example, if the nurse wants to know how the patient is actually using her inhaler, say it's not actually like an emergency situation, but she wants to find out, hey, how would you use your inhaler if you were having an asthma attack? The patient could go through that and show them what they would do, and then the nurse could critique the patient on whether or not that was done right or not. So yeah, that's pretty much what I've thought of with the patient. With peer examples, it's definitely used more in peers, peer-to-peer, like nurses to nurse. In the one article that I found, there's a study that was done in a nursing home where the nurses actually role play with an on-call provider to see what it's like and to teach them the skills needed, because there is no provider in the house over the weekend. So if anything happens in a nursing home over the weekend, they would have to call the on-call provider. Another thing would be just if a nursing supervisor could role play calling the on-call provider, which is a little different because if it's like a hospital inpatient, you would call for a different thing than in a nursing home. Another example would just be role-playing like a code situation, because those things don't happen as often, and it's good to know how you would respond. And then lastly, nurses can role-play together to practice educating patients. So if someone acts as the patient, someone acts as the nurse, they could practice education. And definitely role-playing is used in student teaching just because of simulation lab and all of that. Role-playing is used. So in one article, they did mention that the instructor used role-playing for their actual nursing final grade because they found such a good benefit in it. But role-playing can be used in education, just allowing the student to role-play and practice as what it would be like to be a nurse. So the student nurses could role-play about a mental health unit situation, just with a patient who's threatening to hurt themselves, just so they could know what it's like to be in that situation as the nurse and how they would respond. And then another example is just a nurse and two student nurses could role play a head-to-toe assessment where one is the nurse and one is the patient. These are just simple examples, but role playing can be used in different ways. So I feel like role playing is definitely a very beneficial learning style because you can, like I said earlier, you use both the cognitive and what's the word I'm looking for? Just like physical there. So that really does allow you to learn it very well. Here are the references that I got my information from, and that's the end of my slide. Thank you.